When my doctor called me to give me the news, I was actually at the park with my 7-year-old. She told me right then and there that I had breast cancer. I felt like, you need to try and hold it together as much as possible. My first instinct was to call my mother-in-law because she had already been through this, and I knew that she could be a shoulder to cry on, so to speak, but also I was so concerned because I had to tell my husband.
And so, she pulls me in and she tells me that she had a conversation with her doctor that morning, and that she had confirmed that she had breast cancer. And I think immediately for me, I think my first immediate thought is I'm scared. Sometimes people tend to hyper-focus on the negative side of things, and I'm sorry. And I think that was you get a rush of 100 different emotions all at once. And I think the best part is she was so positive. Married for almost 9 and together for over 10. And conversations we have is what she wants actually done with what's left if she dies. She specifically said to me, she's like, I want to be a tree. So, and but yeah, talking to your wife about how you're gonna make her a tree if she's no longer here. It sounds so silly, but it's it's an emotional thing to talk about.
And as far as healthcare, I have to be honest, I was a bit scared and a bit nervous going into the hospital, not knowing, how I would be treated because I'm so young. I was, sometimes people think that you're stronger or you're strong enough or you can get through it better than someone that's older than you. But I mean, this has knocked me down more than any illness I've ever had. Obviously, it's cancer. So I had no idea what to expect. And I was really scared going into the oncology department and getting a tour and looking at all the scary machines and hearing about all the different types of medication I'm now taking, all the supplements I have to take. And
as many of you are aware, cancer has become a big part of many people's lives, with more than 1 in every 2 to 3 people being diagnosed with it on an annual basis here in Canada and around the world. Cancer management has changed a lot over the last decade, and that has meant bringing a lot of new treatments to patients in Ontario and Canada. And here at the Belleville General Hospital, we take pride in being able to provide that cutting-edge, top-of-the-line care for the patients here closer to their home. Whether it's just for them being around when they are coming home from a treatment and need care, or if they need a ride to their treatment, or even if it's just for emotional support going through something that's making a big impact on their life. The other thing is that the whole point of chemotherapy and treatments and cancer care in general is to provide patients with quality of life and help improve their lives. So anything that can be done to help prevent them from spending that precious time that they're gaining, traveling and having to go from clinic to clinic and different places to get the treatment they need is very helpful. And that's why it's important to be able to have the care given to them at a cancer center that's just down the street from where they live. Cancer care, unfortunately, is not cheap, and there's a lot of different factors that need to be taken care of that may not necessarily be funded through the usual ways that healthcare is funded in our province and in our country. And that's where the collaboration between the Cancer Center and the foundation and our donors comes in. There are a lot of treatments out there that are approved and we know work can help people live longer, but unfortunately are still going through the process of being funded. And in the meantime, the patients are waiting for these treatments to become available. The foundation and the donations that we receive help us pay for medications that may not still be available to patients, and that can make a big difference for someone from not having the treatment they need in a timely fashion to getting what they need and living longer.
So, and I mean, that's exactly why, the gala and these other types of fundraising are really important, because we really need up-to-date machines. We really appreciate the people that are donating to this type of a cause. Without these machines and without these tests, people like me would have to travel to Kingston or further. And I consider it very, very lucky that I'm able to stay local, because traveling is definitely not easy for me. I'm not able to drive much myself. If we're able to have the care, the quality of care that we really need here in Quinte, people like me and others are eternally grateful for that, because it's bad enough and hard enough to be sick, but to then have to try and go other places to get the same level of care is, nobody wants to have to try and struggle on top of your struggle. So it's really important that people donate. It's really important that we support our local community, and we appreciate it so much that we don't have to go to Kingston every week. And it's really great that we have these types of lovely care here locally to be able to take care of us, take care of me.